with physical therapy, it's such a personal thing, right? Like when I go to a patient's house and I see them for whatever injury, I can tell them they could do this exercise like right there, and I can see their home environment, and I can see what their day to day looks like. And I think with one-on-one care, especially in the physical therapy realm, I think that's going to still be needed more so than the telehealth stuff. Because I did telehealth for a brief period of time, like during when the pandemic first started, and there was still some like struggles there. And so I think with Luna and the ability to do it at home, I think is going to be more important, and at least a leader more so than like this telehealth kind of direction people are starting to go in.
Yeah, and I think that every solution has its pros. So, what did Luna find as its really important problems to solve? So, when we started doing some analysis, it was identified that a patient that actually goes into a clinic, 70% of the time, patients don't complete their course of care. So we also know patients that go to for in-person care to a clinic can have challenges. And if 70% of your patients don't complete care, they're not returning back to full function and the most efficient them, right? The second thing we analyzed with one of our health system partners was that when you go to a clinic, 87% of the patients that go to a clinic for outpatient PT can actually be seen at home without any issues or without any lack of progress, and without compromising quality. So, if patients can be seen at a clinic and at home with similar outcomes with great quality care, then why not have them start receiving care sooner? So access is another most important thing that I think Luna is doing great at, is improving access. Patients don't have to pay extra co-payments. They're getting care anywhere from 6:30 in the morning to 9:30 at night. So why stop them from receiving care just because they have to go to a clinic? Why not receive that same care at home? And then the last piece was identifying and surveying our patients. And we saw that 63% of our patients that were given an option to do home versus in clinic, they chose home and they wanted the care at home. So I think just knowing all of those pieces, we know that patients want in-person care, especially with physical therapy.